Hey, Kerri Ciullo, and welcome to the Tick Bootcamp podcast.
Hi, I'm so glad to be here.
We're really excited to have you as well, Kerri. And let's first begin by sharing with folks that you live in the Lyme Belt. So where do you live and how long have you lived in the New Jersey Lyme Belt?
So I am from Hunterdon County, New Jersey, and I have lived here my entire life. So I've been
So
surrounded by ticks since day one.
yeah. And New Jersey is a beautiful state. It
It
really is a
is.
beautiful state. But unfortunately, with all that beauty comes some danger, right?
Yeah,
And
unfortunately.
the danger that you have and you've grown up in, and I've had, and I grew up in the Lyme Belt here. I grew up on Long Island. Is that we are going to have to deal with the realities of coming in contact with ticks, right? Um, let's talk about your childhood, Kerri. So you grew up in this beautiful state on the East Coast. And what kind of childhood did you have, and what kinds of things did you enjoy doing?
Um, so as a child, I love to be outside, which I'm sure has played a big role in my Lyme experience. But I've always loved just playing outside, being in nature. Being around animals. I've always been drawn to any sort of like art, being creative. That's always been something that I've considered a big part of myself. Um, and since I was a child, I just tended to kind of like to do my own thing and be in nature and create.
Talk about your educational experience, Kerri. We have great schools on the East Coast, and New Jersey has some of the best schools in the country. So, what was your educational experience like, and what kinds of things did you think were going to be, in your future from a career path standpoint?
Um, I I actually ended up missing a lot of school throughout elementary school and middle school and high school because of an unknown illness and different, mental issues that would come up as far as anxiety and depression and panic attacks. And I had, a lot of stomach issues and headaches. So I missed a lot of middle school and high school, but I was able to graduate. And I was planning on going to college. But unfortunately, I started to get really sick around 18, 19, which is right when I was looking at colleges. And I just ended up going to a community college for a while because I was dealing with so many health issues. And then shortly after, I became so sick that I ended up dropping out. But I had always dreamt of, going into the arts. My dream was to be an artist, even though it's not necessarily a reliable dream. That was my dream to even just teach art or be in the art world somehow. Yeah, but my dreams kind of were put on hold because my life was always kind of circled around these unknown health issues that I had that seemed to be getting worse the older that I got. So yeah, I so much of my life was so focused on health that I think my goals became very limited because my world became really small. But they were always wrapped around, just creating and teaching people how to create because that seemed to be the one thing that got me through so many hard times and kind of let me reframe those hard times into creating something or making something beautiful out of a hard scenario.
So it's not going to surprise folks on this podcast that, of course, you ultimately diagnosed with Lyme disease. But I don't want to get to the diagnosis yet. I want to talk about
Sure.
what your symptoms were during your childhood first. What were the challenges that you had that caused you to miss so much school?
So, my mom had said that even as a toddler, I was always really fatigued. I would complain about headaches and stomach aches. And that continued on throughout the years. So by the time I was around 8 years old, I was seeing a gastroenterologist and I was put on different antacids and Pepcid and all different things to kind of help with these stomach issues that I had, which seemed to be the biggest issue when I was young, was just constant stomach pain and digestive issues and reactions to certain things. And I was told for many years that it was anxiety and that I was experiencing these things out of a psychosomatic response because I was convincing myself that I was sick. So as I got older, at around 12 years old, when my menstrual cycle started, was when I really started to notice these symptoms that kept me out of school. Headaches, body pain, constant fatigue, brain fog, tremors, reactions to food, just confusion, severe arthritis at such a young age. So by the time I would say I was in high school, I had missed 3 years of school, and I was homeschooled.
So let's talk about the impact that your illness had on your relationship with doctors. How many
Sure.
doctors between the time that you first started having your symptoms as a toddler and the time that you started college? Let's use that as the window. How many different doctors do you believe you saw in that window of time?
Wow. So I was seeing specialists from like age 8 on, and I had seen every specialist under the sun. So I would estimate it's probably like 30 to 40 specialists, um, by the end of it, if not more. Um, there were so many after a while, they just started to blend together.
And what was your perspective on the medical profession based on being sick for so long, not having any type of diagnosis, and then in some cases, doctors essentially saying that it's all in your head, either because you're anxious or it was psychosomatic.
I became really distrustful of the medical community, just because I know my body and I knew even from a young age that something was wrong. And to be told, especially when you're young and developing, that what you're feeling is false and that, it's an anxiety reaction, was really hard for me. And I think it made me kind of question my own experience and if I could trust what I was going through. But it really just made me almost angry at the medical community because I felt like I was truly being failed. And my mom, was helping me and taking me to every specialist possible. And they were all saying, we can't find anything wrong with you. And it just felt like maybe they didn't know enough or they weren't trying. And it was just, I really felt like I had lost all of my faith in the medical community, which was so hard because we're all taught that when you're sick, the people that you can trust are doctors. And unfortunately, as so many people in the Lyme community know, that's no longer the case, because so many doctors just lack proper education on Lyme disease, and how it can affect so many people so differently.
Now, do you think the mindset that was created by these experiences with doctors failing you exacerbated your illness? Meaning, do you think it was immunosuppressive for you to constantly find yourself in a difficult position with your doctors, and as a result, you became more sick?
Definitely. I think just the trauma of feeling like I wasn't believed and that I kind of had to convince people over and over again, that something was truly wrong. Just the stress of that, at such a young age was debilitating. And I'm still working through those years of trauma because when you know something's wrong and everyone around you is telling you it's in your head, it really does kind of mess with your sense of self and, your experiences.
So let's talk about your experiences, because in many cases, when we're gaslit by doctors or failed by the medical community, it also has an impact on our social relationships. And in many cases, our family members and the people who are the most important to us begin to doubt whether or not we're really sick. Did you have any experiences with the medical gaslighting or the medical failures that caused family members to doubt whether or not you were sick?
Yeah, unfortunately, I did. There have been points in my life where I really felt like the only person that truly believed or, understood what I was going through was my mom. And it was really isolating, even within, extended family, because I knew that they didn't really believe what I was dealing with or didn't understand it. And that was really isolating as a kid. And there was some anger that was created there because I felt like, why can't anyone believe me? Why isn't anyone on my side? So that definitely played a part in feeling isolated.
And did part of the disbelief not only stem from failures of the medical community, but did some of that stem from you not looking sick, right? Because one of the things we know about Lyme disease is it really is an invisible illness. And in many cases, people just think that we're malingering or we're um, engaging in psychosomatic presentations because we look good. Was that an issue for you, or did you look sick in a way that was just undeniable?
That was a huge issue for me because for years, I didn't look sick, and I was very good at kind of putting the act on that I was okay and that I was happy. And because I got so used to, just feeling like I had to constantly seem okay, because if nobody believes that I'm sick, there's no point in trying to convince them. And there was a point when I got deeper into the Lyme diagnosis where I was obviously sick. But I'd say for the first 10 years or so of being really sick, nobody did believe me because I looked like a normal, high schooler.
So what impact did this have on your social life, meaning friends and intimate partners? Were you during your high school years, or even before that, in a place where you had a group of friends and other types of people that you'd have relationships with, or did your illness interfere your ability to develop social contacts?
Thankfully, it in the beginning did not really affect my social life. I was able to make friends easily. But as the years went on and I really got sicker and sicker and more isolated, it definitely affected my social life and how I felt like I could relate to my peers, because I was sick for so long and just had so many experiences that most young people don't have, that it got to a point where I just felt kind of like an outsider. So thankfully, it didn't affect my social life as a youth so much, but it's definitely kind of affected my social life as an adult because I feel like it's really the experiences I've been through have been isolating and so unique. So and being so sick for so long, I got used to being by myself. And I think I almost kind of liked being in my own little bubble, because that just felt safe. And it felt like I didn't have to put an act on. I didn't have to seem like I was okay or that I felt good when I wasn't feeling good. So I'm trying to work on that more now and put myself out there and be more social again.
And
But
and
I
and
think,
and it's
I
really cool.
think,
I mean, look, you're doing cool things like coming on
yeah.
podcasts to help other people and being vulnerable. And this is the kind of thing that we really love about Tick Boot Camp, because in many cases, folks are ready to now come out of the bubble of protection that they've created for themselves because there have been so many isolating experiences. And I want to thank you for doing that. I want to thank you for just coming on here and sharing this with us today.
Oh, it's my pleasure. Thank you for having me. It's definitely, I'm a little bit nervous, but I'm really glad to share my experience. And I just hope that everything that I've been through can have a greater purpose and help others from having to experience the same hardships.
Well, you're well on your way, young lady. You're doing a great job so far. So let's
Thank
let's talk
you.
let's talk about your diagnosis. How old were you when you finally received the Lyme disease diagnosis?
So I had gotten a few diagnoses of like a generalized acute Lyme, probably in my mid-teens, so like 15, 16. But it was never really diagnosed as chronic Lyme. But at around 19 years old, I went on a family vacation to Florida with my family, and we stayed in what I now know is a very, very moldy condo. And I was just made so sick from that condo. I was never the same after it. So I started seeing doctors that summer when I had gotten home, and that is when I got the diagnosis of late stage Lyme. So I was 19 when that happened.
Okay, so let's build out this diagnostic journey because it sounds like Lyme became a part of your medical experience earlier than the mold experience that triggered you into the chronic presentation. So
Hmm.
how did you first hear about Lyme disease and how is that connected to your symptoms?
I think I first heard about Lyme disease from a therapist because I was brought to so many therapists as a kid and a young teen because once again, I was told that so many of my issues were psychosomatic. So I was going to all different types of therapy. And I believe that it was a therapist that brought up, have you ever looked into Lyme disease? You know, a lot of these symptoms sound like Lyme. So
You remember
then
how old you were? Kerri, how old were you then?
I was probably 14, 15,
Okay.
as an estimation. But yeah, so I then went to this my general practitioner and they tested me because I think I had gotten a tick bite when I was like 15 maybe. And they were just like, "Oh yeah, it's probably Lyme. We're gonna give you like a week or two of antibiotics and you're gonna be fine." So I did that thinking that, oh, 2 weeks of antibiotics is all I need. So it's not going to be Lyme disease because I've already checked that off. So then a few years later, I learned that no, it's been Lyme this whole time, and 2 weeks of antibiotics is not how you treat Lyme disease. And it's just not, there's no proven efficacy for anybody. So yeah, it was I got little glimpses of the diagnosis, but I never really knew just how long I'd had Lyme. Um, and we really figured out that I had probably gotten it from my mom gestationally, because she had remembered getting a tick bite while she was pregnant. And I had so many symptoms at such a young age that it seemed to make sense.
So you of course were living in a tick endemic community your whole life, right?
Yeah.
And
Hmm.
so let's talk about, your educational experience both in school and through social contacts, whether it be parenting or other experiences you had. Again, you're growing up in the Lyme Belt. People are getting bitten by ticks all the time. Did you feel equipped to avoid places where ticks might be? Uh, Checking yourself to see if ticks were on you, properly removing ticks if any were on you, and then of course the steps you would take to try to protect your health in the event that you suffered a tick bite. Did you have any of those skills to keep yourself healthy from tick experiences?
Well, the house that I am living in, that I grew up in, is where I think I've gotten most of these tick bites in the yard. So I had to learn very soon how to check myself after being in the yard constantly, and what to do if I was bitten by a tick, because so many of us are told, you're bitten by a tick, just pull it off and burn it or throw it out, and you don't have to worry about it. But the reality is, when you're bitten, you need to save it and you need to send it in for testing and see if it's infected with anything. So yeah, I wasn't super educated on how to properly handle a tick until years later. I just knew that I had to check myself after being outside. But as the years went on and I spoke with more people who were so educated on Lyme and how to deal with tick bites, I was taught that, anytime that you have a tick attachment, you need to save it and you need to send it out for testing because, so often we're bitten and we don't know and we don't get a bullseye. So we don't even think to test for Lyme or look for Lyme. So I think the years of just being in the Lyme world and talking to more and more people who have experienced it taught me the proper way to deal with ticks. So now I do feel more capable of handling it properly.
All right, so let's talk about companion animals. Do you have any dogs or cats or any other companion animals? And were they indoor and outdoor animals?
Yeah, I have, at the time when I was diagnosed, I had a dog and a cat, and the dog was indoor outdoor. So I know that he was probably bringing in ticks from the yard as well.
Right, so 80% of the people who have Lyme disease receive a bite either in their house or in their yard, right? And one
Hmm.
of the things that we always find interesting here at Tick Boot Camp is most people will check themselves after they go on a hike or they do they go camping. But as it turns out, that's really the rare experience when it comes to getting a tick bite. It's generally you're in your yard or an animal you have comes in the house and they bring ticks in with them. One of the things that we laugh about in my house is my dog Hazel goes out and collects ticks, and then she throws them off on all of us when she comes into the house. It's almost like she's trying to do it on purpose, right? So you knew you had to check yourself beginning at what age, and was it also something that you were told to do regardless of whether you went outside, because it was likely that your animals were bringing ticks into the house?
I was taught to check myself at around 19 when I got the true late stage Lyme diagnosis, but it was never brought up to kind of check your pets or look at the dog that's going in and out and rolling in the yard. That's something that I unfortunately have had to learn from experience, because I have gotten tick bites from being inside with a dog laying on my lap. So it's something so many of us have to learn the hard way.
Yeah. And unfortunately, it's just not a part of our educational experience, even here in
No,
Orlando, right?
yeah.
It's just simply not. So let's talk about tick checks, right? So what does a tick check look like to you now? Meaning, if you were to instruct someone on how to check themselves for ticks, what would your step-by-step guide be?
I usually like to take my phone flashlight and I start from my feet or my ankles and I just check every little crevice between my toes, behind my knees, and up under my armpits in the creases of my arm. I've found that most of the bites that I've gotten seem to be in, creases or, spots that seem to be warmer. And that seems to be where ticks love to go. So behind your knees, between your toes, on your under your armpit and the creases of your arm.
So Kerri, but how are you doing that? You said you're using your phone. Is that just a visual inspection, or are you doing something?
Yeah, it's a visual inspection, just like with a flashlight. And sometimes I have, somebody else check like my back and my hair and my scalp.
All right. So
Yeah.
one of the things we talk about here at Tick Boot Camp is the eyes of the hand, right? As it turns out, your thumb, your first finger, your second finger, and half of your third finger um, are very, very sensitive parts of your body and can feel very, very minor changes. And if actually you combine a visual check with a physical check, meaning you're rubbing your fingers around your
Hmm.
body, that combination of sensory experiences make it substantially more likely that you'll find a tick. So I just want to share that with you, that um, using the same tools that a blind person would use to read Braille, for example, would serve you really well if you're doing tick checks. So I just wanted to pass that on to you, that I want you to keep doing your tick checks, and I
No,
want
that's
to make
that's
sure
really interesting. Thank
yeah,
you. It
you're
makes
using
sense.
both your visual and your tactile tools, right? So let's now talk a little bit about how your experience changed after you finally got your chronic Lyme experience. I mean, your chronic Lyme um, diagnosis. So you said that you believe, based on information you'd received, that you probably were infected congenitally.
Yeah.
But you also shared with us that you've been bitten by ticks many times, right?
Yes, I have.
And of course, the challenge with these types of challenges is, what comes first, the chicken or the egg, right? And
Yeah.
was it one or the other, or is it all of the above, right? And you clearly weren't given adequate tools to avoid ticks as a child. You clearly weren't given adequate tools how to find ticks. So your educational system failed you, and now and you're living among the ticks. I mean, it's just where we are on the East Coast, right?
Yeah.
Um, so um, now, one of the things that we've learned here at Tick Boot Camp is that rarely do you go from tick bite to chronic illness. It does happen. And just to share with you, you actually found yourself in one of those situations where that might have happened, even if you didn't have all of these microbes, in your system, with your immune system managing them, because there are two instances where most experts argue you'll go from tick bite to chronic illness. One of which is if you're in a moldy environment, because mold is immunosuppressive, right? So you can have your body trying to battle these microbes that were recently spit into you by a tick bite, and now you have the additional immunosuppressive mold experience. So do you think that your body was sort of just in in a position where it was managing these microbes, and then you had the moldy experience, and that's what ultimately caused the pot to boil over? Or do you think you had a tick bite just before then that caused the pot to boil over when you found yourself in the moldy environment, and then it all sort of dogpiled together? What would be your thoughts on that?
I think that it was a mixture of multiple factors. I think I started off kind of weak as a child. I was a premature baby, and I had some health issues from the minute I was born. I had to stay at the hospital longer because I had some difficulties with swallowing. So I think I was also living in a moldy environment. Well, I know I was living in a moldy environment. So I think all of these factors kind of added up, and it got to the point where I had maybe one too many tick bites, and it kind of just boiled over. Because when I was a kid, while I was still living in the same house, the same environment, I didn't have as many tick bites, and I was still somewhat normal, so to speak. And I think after getting these accumulation of tick bites over the years, I think it was just one too many, and there were too many microbes, and it just became too much for my body to handle while I was also living in a moldy environment and never being educated on molds and not knowing that my house could really be making me sicker.
Right. There are other factors that I think are causing folks to suffer from Lyme disease, chronic Lyme disease today more than they did in the past. And I'm not gonna walk down the path of whether or not Lyme is a bioweapon or not. We've had many episodes. We just published one recently where there are some folks that are making that case where the microbes are more viral. But I'm not gonna have that conversation today with you. I'd like to just put that on the shelf, and let's focus on the other things that young people, especially young women, have to deal with in the society that we're living in, right? Because we have a ton of heavy metals that we're coming in contact with. We have all kinds of petrochemicals that are a part of our clothing and our experiences. We have food degradation where we don't really have nutritious food. And of course, as a young woman, there are a lot of social pressures, especially those that are coming from social media, that just make it really difficult for us to live in anything other than a stressed state. Give me your thoughts about those other inputs that may have been causing you to be immunosuppressed, in addition to some of the early issues that you were describing for us.
Yeah, I think that as a woman, there's definitely a lot more pressure. And we're surrounded by toxins everywhere. And another factor for women is that so many beauty products are just filled with toxins, and makeup is filled with toxins, and fragrances, and you could go on about how many products that mostly women use that are just so incredibly toxic, and that we're conditioned to use at a young age. I was using makeup, age 11, 12, playing around with makeup, and perfumes, and like most girls do when they're young. And we just had no education that all of these products were so toxic and just creating layers of toxic waste in the body. And another factor for women too is I was put on birth control from age 12 on because I had such severe menstrual cycles. So there's another, list of toxins and hormones that are being flooded into your body, that create, the perfect storm to then get a tick bite and have everything go haywire.
So let's talk about your diagnosis, right? So you started to have Lyme on your radar
Mhm.
earlier in your life, but it wasn't until you were 19 that you were finally diagnosed with late stage Lyme disease. When was the first time you took a test, a Lyme disease test? And how many different Lyme disease tests did you take?
The first time I took a general Lyme test, I was probably in my mid-teens. But I took a true Western blot, and a full panel with a Lyme specialist at 19.
Okay, and were you lucky? Were you one of the lucky ones? And did you get from your Western blot or your ELISA, a positive result?
The first few tests that I did were negative. So that's why I had kind of put Lyme out of my radar. because I wasn't educated that many of the testing can be flawed and that you can get a lot of false negatives. But when I did see the Lyme specialist and he did a more thorough test, that's when I finally did get a positive Lyme diagnosis.
Okay. And what type of Lyme test did you take for your positive diagnosis?
Um, I believe it was the Western blot.
Okay.
Yeah.
And other than the traditional Lyme tests that you took, did you ever take any Lyme tests from any specialty labs like Igenics and Aura labs or any of those other specialty Lyme labs?
I did do it through Igenics, yeah, later on with another Lyme specialist.
Okay. And was there a difference in the diagnosis between the positive Western blot and the Igenics test?
Yeah, because I then showed positive for Babesia and Bartonella as well. And those two diagnoses were never brought up prior to
Okay.
that.
Now, were they not brought up because you did not take, when you went to the first doctor that gave you the traditional test, did that doctor use a full Lyme panel so that they could find other co-infections, or were they just testing for the one strain of the one bacteria that some people use to define Lyme disease?
Yeah, they were just doing, the most bare minimum test possible.
Okay. So let's talk about Lyme disease and how we define Lyme disease, because one of the things that I find to be the most disconcerting about Lyme disease is there are as many definitions as there are experts, right? Some argue that it's acute disease, some argue that it's a chronic disease, some argue that it's one bacteria, some argue that it's many things, many microbes. So as one of the experts in this community, Kerri, how would you define Lyme disease?
I think that it's a mixture of, multiple bacterial strains. I think that for so long it's kind of been generalized as one bacteria. But I think, the more we're learning is there's multiple variations of the Lyme bacteria. And the more you test and the more you read about it, there are so many different variations and they almost have different symptoms that they can create. So I think that obviously it's a mixture of multiple things going on and that people don't generally think about it in that way.
All right, but I'm glad my new friend Kerri is very smart and she is defining it the way she is. So let me give you the Tick Boot Camp definition of Lyme disease, right? We define Lyme disease as a polymicrobial, multisystemic, chronic infectious disease. We do not believe it's one bacteria. We do not believe it's only one system that's affected, and we do not believe it's an acute disease. That that to properly define Lyme disease, it is polymicrobial, multisystemic, chronic infectious disease. Give me a reaction to our definition. Tell me whether you like it or you don't like it, and you don't have to be nice to me. You can tell me if you don't like it, and tell me if you think that definition speaks to your experience.
I love that definition and I think it's spot on and it definitely speaks to my experience of having every system in my body being affected by this. And I think for years, so many doctors didn't believe that it could affect every system in your body. And I have experienced it firsthand. So I really think that that sums it up perfectly.
So one of the reasons we've learned from guests in the past that cause doctors to believe that you're malingering or you have you have a psychosomatic disease is because what happens is you go to the doctor one time and you have knee pain, and you go to the doctor the next time and you have stomach pain, and you go to the doctor the next time and you now have some emotional symptoms. And because it's presenting differently at different times, doctors think you're making it up because there's no consistency in the presentation of symptoms. It sounds like, based on your history, that you had that experience. If that's true, let us know. If it's not, please correct me. And you believe that's one of the reasons why it's so challenging for young people to get a diagnosis and to be believed by their doctors.
I definitely think so. And from my experience and from speaking to so many people who have been dealing with chronic Lyme, everybody experiences it so differently and it acts differently in each body. And some people, have more pain. Some people have more neurological issues. Some people have more digestive issues. So it doesn't have a singular appearance, which I think makes it harder for doctors to say, hey, this is Lyme. It can be varying from day to day what your symptoms are with Lyme. One day you can be in severe pain, another day you can feel like you're going to have a panic attack all day, another day, you can have major digestive discomfort. So it's such a strange disease in the way that it shows up in the body and in how the symptoms you can experience can differentiate so much just day to day that I think that it makes it very hard.
It does. I mean, migrating symptoms are one of the things that cause doctors to believe that you're suffering from a mental illness rather than a physiological illness. And that's really a challenge. So another one of the things I want to ask you about, it sounds like your mom is an absolute superstar and she always believed in you and she always brought you to different doctors. And, the work of Dr. Brian Fallon at Columbia University demonstrated that the average child who has Lyme disease must see at least 7 different practitioners before they're diagnosed with Lyme disease. Sounds like your mom went above and beyond. You went to over 30 practitioners, right? But the average is about 7. And in many cases, what happens when parents are bringing a child from doctor to doctor and doctors are struggling to diagnose them, that they think that the mother is making up the disease or the mother is suffering from a mental illness. Do you know if your mom ever had to deal with any doctors accusing her of essentially, suffering from, Munchausen syndrome by proxy?
So my mom is a superstar and she is the reason that I am continuing to get better. But yeah, I was actually there. It was actually a psychiatrist that kind of made an assumption towards my mother that, maybe she was creating some of these issues. And I was probably like 12 or 13, and I immediately told him off. And I said, no, my mom is actually my only advocate. She is the only one that believes me. And she is the reason that I'm going to get better because she is the only one that is pushing these doctors and taking my word. And she knows her child. She knew that something was wrong. But it really maddened me so much to see someone even question her motive there. But yeah, it's amazing how many parents I'm sure experience that.
Yeah, it is terrible and it's very common. And I'm sorry your family had to deal with that. But it sounds to me that it only strengthened your resolve to not only, then advocate for your mom, but also to become your own advocate at a very young age.
Yeah, it definitely did.
All right, so let's now talk about your diagnosis, right? So you took various Lyme disease tests and you were diagnosed with Lyme disease, but you had many, many different microbes that were causing you to be sick, right? So we know that that when a tick bites you, you can have up to 200 microbes spit into you. Unfortunately, science has only defined somewhere in the neighborhood of 19 that they can identify. So how many of these identified microbes, whether they be bacteria, viruses, protozoa. How many of these were in your system?
I believe it was there was Bartonella, Babesia, Mycoplasma pneumonia. That was it, thankfully. I know of people who have had a lot more issues going on from tick
Oh, we
bites,
don't
but
we don't need to
yeah.
compare ourselves to others.
Yeah.
Yeah, no, we don't want to discount you being sick.
Yeah.
There are many people that were sicker than
Yeah.
me. So I guess, so you had Borrelia, Bartonella,
hmm
and
Yep.
Babesia. And
hmm
we generally see those 3 Bs together often, right? They do, and of course they present differently. And one of the challenges with having at least those 3 microbes affecting your system is, in some of those microbes will slow down your immune response. Some
hmm
speed up your immune response, right? So you start having this, these challenges. Some of these microbes will combine with not only each other, but they'll combined with other microbes in your system that your body had been managing, which you just outlined that was happening with you. Right. And in the end, your immune system is being pulled in so many different directions. Ultimately, what happens is, our immune system is out of homeostasis, it's out of balance, and we become chronically ill, right? And that's what happened with you, right? You became
Yeah.
chronically ill. So talk to us about, how bad it was, for you at the worst. What was the worst state you found yourself in on this journey?
The worst I found myself in was probably around age 23 to 24. I had already been through years of oral antibiotics. I had had a PICC line. I had been through more years of herbals and homeopathic drugs. And I was at the point where my body was just reacting to everything. I was 50 pounds overweight with inflammation. I was in so much pain every day that I slept with multiple ice packs around my neck and shoulders because I was just so uncomfortable. I couldn't sleep. I was so neurologically impaired. It was hard for me to read. I would be driving and forget where I was or where I was going. The physical pain and the constant fatigue kept me from being able to work. Um, I was just suicidally depressed, so uncomfortable, felt like I had no future. I had tried every treatment for Lyme that I thought was available. So I was really at a loss. I was hopeless. And I was essentially told by doctors that, you're going to continue to get more and more disabled. And it was very much inferred that I was not going to live very long. So I think that was really my darkest point, and I really was convinced that I wasn't even going to live to 30. So it
I'm
was a
sorry.
rough time. Oh,
That
it's okay.
does suck. That really does suck.
Yeah, yeah,
So let's talk about all the treatment you did up until that point. I'd like our folks to hear, right after you received your chronic Lyme disease diagnosis, you did share with us that you had a short course of antibiotics after a tick bite, and that did nothing for you.
yeah.
Was that doxycycline that you had taken at that
Yes,
time?
it was. Yeah.
All right. And that was just for 2 weeks. Of course, we all know that
Hmm.
that's not going to be adequate because the life cycle of the bacteria that you had spit into you is substantially longer than 2 weeks, right? So generally, what
Hmm.
happens is it takes away the symptoms, but not necessarily giving your immune system the support it needs by reducing the microbe load, right? But what other things did you do from the time that you received the diagnosis, and don't share with us anything after you had this low point that you described at about 25. Well, give us all of the different treatments you did and how it either helped you or didn't help you.
Prior to the
Prior to,
low
yeah, right.
point.
So right after
Yeah,
your diagnosis, what your chronic diagnosis, what types of treatment? Because you said you did a PICC line, you gave a whole list
yeah.
of things, but let's
Hmm.
go through them step by step and talk about what you did, why you did it, and how it either helped you or didn't help you take the next step in your treatment journey.
Sure. So the first thing I started with was multiple antibiotics at a time. I think I was generally on 2 to 3 different antibiotics at a time, and that was it for around 2.5 years.
Okay, so let's
And that
pause on that, Kerri. Were you taking multiple antibiotics at one time? Were you pulsing these? How were you taking these antibiotics, and what were the antibiotics?
I was taking multiple antibiotics at one time. I was not pulsing them. It was all at once and consistently. And I've taken every antibiotic under the sun. I was on amoxicillin, I was on doxy, I was on zithromax, I was on I can't even think of half of them. It's been so many. And then I was also on Mepron because I that was treating the Babesia, and I was doing that during the antibiotics as well. So it was just multiple drugs at once, and that was for around 2.5 years.
And during that first 2.5 year window, were you taking anything other than antibiotics?
No. just antibiotics.
And before you started taking the antibiotics, was there a period of doing any prehabilitation, meaning were your doctors giving you any tools to detox, to get your diet in order, to get your sleep in order, to get some movement into your experience, to recommend that you work with a mental health professional to help you get your mindset correct so that you can go on this journey, or they just throw a whole bunch of antibiotics at you?
I wish they did that for me because I think I would have been so much more successful in the beginning if they did. But no, they just threw antibiotics at me. And the one thing about diet I remember my doctor mentioning was don't eat sugar and don't drink alcohol, and that was it. Um,
Well, I mean, again, that both good pieces of advice,
yeah.
not certainly inadequate. All right, so
hmm
for 2.5 years, you're on this whole cocktail of antibiotics. And did that have any benefit in the short term? Did it have any benefit in the long term? And did you pivot from that because it was time to move on to improve your health, or did it just not really have any benefit?
I really did not have any benefit. I think, if anything, it made me much sicker. It made my digestive issues absolutely horrible. I think that, if anything, I had more food allergies after I did the antibiotics as well. I and I eventually tried something else because they just weren't working, and I continued to get sicker and sicker and allergic to more foods and in constant stomach pain and unable to digest anything. So that's when I had eventually said, if my stomach can't take this anymore, we're going to have to try intravenous antibiotics through a PICC line. So it was just, okay, how can we pivot and try antibiotics in a way that's easier in my digestive system?
Okay, so all the antibiotics for the first 2.5 years were oral antibiotics, and now you're pivoting
Yes,
over to now, did you also change doctors when
I
you
did. Yes.
and did the new doctor suggest to you that your gut issues would resolve when you had a different vehicle for receiving the antibiotic treatment?
Yeah, so I started seeing a infectious disease specialist, and he claimed that, if I was getting these antibiotics intravenously, that it would stop affecting my gut, and that eventually my gut would start healing, and it certainly did not.
Right. And one of the things that surprised me and Matt is we often thought that the vehicle for transmitting the antibiotics would have a different impact on your gut. And as it turns out, we were told that that it really doesn't matter what the vehicle is.
hmm
Even IV antibiotics are going to negatively impact your gut. So I'm assuming that while you were having all of these challenges, first with the oral antibiotics and now with this intravenous, that you weren't given any tools to rebuild your gut, meaning probiotics or any of these gut rebuilding kits. You were just given antibiotics, and when you were complaining about your pain, it was just something that you sort of was suggested you just had to suck it up.
Yep, pretty much. Yeah. There was never really any, talk of taking probiotics or what I could do to start, building my gut back up and healing it. It was just kind of like, oh, well, when you're done, maybe you could take a probiotic, but it was never, they never gave me a plan to how I could heal my gut. It was just kind of like, well, you're on antibiotics, that's normal.
Okay. Now we know that because of the vagus nerve, that when our gut is in bad shape, in many cases, it's also having a negative impact on our emotions. How was the negative impact that the antibiotics were having on you, first orally and then intravenously, impacting your emotional state?
It was greatly impacting my emotional state. My anxiety got much worse. My depression got much worse. I was very much in a suicidal ideation, mindset of, it'd be better off if I just died. It'd be better off if I didn't wake up. Especially, taking all of these things that I think are going to be helping, and they seem to be making me worse. It definitely had a major effect on my mental health.
Now, were you treating with any mental health professionals at that time?
Yeah, I was seeing a therapist. I was seeing a psychiatrist. to take certain medications that would help quell the levels of anxiety and depression I was having. But of course, since my gut was so damaged, any of the antidepressants I would take wouldn't really help me at all.
Okay. So how long were you on the PIC line? Well, give us that time. How long were you taking the antibiotics with the PIC line?
So I had the PIC line for around 4 months, and by month four, my body started just completely rejecting the antibiotics, and I was going into a state of almost being poisoned, where I was getting locked jaw and full body tremors, and basically having seizures. So they had to immediately put the kibosh on the antibiotics and pull my PIC line out.
Okay, so let's talk about the PIC line itself and the impact that it had with first installing the PIC line and then having to keep it clean and all the concerns you had with that. So talk to us about where your PIC line was, what it was like to have the PIC line installed in the first place, and what challenges did you have with trying to live life with a PIC line, both when you were receiving the antibiotics and when you were not.
Sure. So my PIC line was by my bicep and my left arm. And getting it installed, I can easily say, was the most painful procedure I've ever had in my life. I was in so much pain for days after it that all I could do was sob. I also had severe nerve damage from Lyme disease. So then going in and putting a PIC line right to where some of my most severe nerve damage was just absolutely excruciating. As far as keeping it clean, that was the easiest piece to me because I had gotten so used to all of these routines I had to do. And being sick for so long made me a little bit more of a germaphobe. So I was very on it with keeping it clean. That to me was the easiest part. I just had a hard time looking at it and thinking about it too long and feeling like, oh my God, there's this PIC line in my arm going into my heart, and sleeping with it and learning how to shower with it. I have a twin brother, and I would have him saran wrap my arm each time before I would try to take a shower. I don't miss it at all.
I'm sure. So you have 4 months of the antibiotics. You ultimately become more sick as
Yeah.
a result of the
hmm
PIC line. They take the PIC line out, and what's the next step in your treatment plan?
So at that point, pretty much tried all types of the treatments for, as far as Western medicine goes. So then I kind of went the more holistic route because with all the research my mom was doing at the time, it seemed like the people that were really getting better were treating it holistically. So then I started seeing a naturopath. And I started the journey of taking different herbals and homeopathic drugs to treat it.
So, what herbals did you take, and what herbals worked for you, and what herbals did you take that didn't work for you?
So I was on a slew of herbals. The few that I can remember are cryptolepis, cat's claw, houttenia, Japanese knotweed. Those were the big herbals that I was on for years, and I was taking around 90 drops of those 3 times a day. I think they helped me a bit. They helped with some of the pain, some of the severe symptoms. But once again, I think taking all of those herbals and homeopathic drugs created more issues. And I started to be more reactive to things, and
What do you
started
more
showing
reactive
more,
mean? More allergic reactions?
yeah, more allergic reactions. Which is, now I know I was also doing all of this while living in a very high mold environment. So that's another big factor.
So let's talk about that, Kerri. So you've alluded to living in the Lyme environment. I mean, Lyme. Sorry, the mold environment a couple of times. Now we know about the one incident you had where you were on vacation and you were in a moldy environment, and that triggered your the chronic presentation of your disease. How did you discover the mold issue in your house?
So I actually discovered it through the naturopath I was seeing at the time. She was the one who kind of brought up the mold piece and how she thought that that was something that was keeping me sick. So I eventually was told to ERMI test my house, and we did that. And I believe it was at like a 14 or a 15. So it was high for somebody who is chronically ill. So then I was then told I had to remediate. So we ripped out all the carpeting in the house. A lot of things were torn down. I had to throw out everything in my room. And I had to install these air purifiers. So that's kind of where I got the glimpse of how mold could be a big piece. But she was the first person to ever bring up how mold could be keeping me sick.
So, Kerri, we've had some folks that we've interviewed who argue that before they would prescribe antibiotics to a patient with Lyme disease, that they would require them to first determine whether or not there was mold in their house and to change the environment. And one doctor in particular told us that he's had many patients who overcame Lyme disease simply by getting the mold out of their environment and allowing their immune system to become more healthy. Did you have any benefit as a result of removing the mold from your environment?
I definitely had and noticed benefit from it. I still haven't gotten to all the mold. It's very hard to address mold, especially with the environment we live in. It can be very humid here. So yeah, with the remediation that I did complete, I did notice some changes, and I did notice some symptom reduction. But I can also say that everybody that I know of personally that's really gotten better from Lyme has also addressed the mold piece and has gotten out of mold. So I think that that really is a huge factor.
Okay. So let's talk about the next thing you did. What other types of treatment did you do after you dealt with the mold issue?
So I was doing herbals and the homeopathic drugs for about another 2.5, 3 years. And then I again kind of plateaued and reached this point where I wasn't really getting better. And I eventually found bee venom therapy, which is what I've been doing for the last 4 years.
Okay, so let's talk about that. This is a lot of controversy in the Lyme community about BVT.
Yeah.
And we've had several guests, on this podcast who have used that tool. And one of the things that we talk about all the time here is that you want to make sure that you're not using a heroic therapy until you've sort of run out of options, right? And
Yeah. Hmm.
it almost sounds like you were running out of options, that that you had done almost every Western and traditional therapy that you could possibly do, and now you started moving over to the heroic. So talk to us about why you decided to try the bee venom therapy and what the risks were that you were concerned about, and what steps did you take to try to protect yourself against the risks associated with bee venom therapy treatments?
Sure. So by the time I had found bee venom therapy, I was pretty much at a loss. I wasn't really improving with any of the other treatments I was doing. So I said, you know what do I have to lose? I have no life. I was barely even existing. So that was really just, I had to have faith that it was going to help me because there was really no other option at that point. And as far as the risks, I was just afraid, obviously, of anaphylaxis or, I was never afraid of the pain because, as Lyme sufferers know, you're very used to pain. So pain was never the piece that scared me. It was just the reaction piece. But I've been working with the Heal Hive, which has been super educational and has kind of helped me do it in the safest way possible. Because I know of a lot of people who've kind of just started bee venom on their own and through Facebook groups, and they don't really know all of the precautions you have to take, and they can end up making themselves sicker. So it's definitely something that shouldn't be taken lightly and that you really need to properly educate yourself on before ever trying.
Okay, so why bee venom therapy, and why do you believe that it's an effective treatment in your presentation of Lyme?
Honestly, I had the biggest reduction of symptoms I've ever had from a treatment. I can easily say that it saved my life. I had such major heart issues before I started stinging with bees that are now completely gone. And I can only attribute that to bee venom therapy. Um, Yeah, I've just seen so many improvements that I let that outweigh any fear I had of reaction because I'm taking all the precautions to keep it as safe as possible. And everybody that I know of personally that's really healed and is doing well has stung themselves with bees. So I kind of just had to follow the people who I saw were truly healing.
Okay. So tell us about the educational elements of the work you did and what type of precautions you had to take before you began the stinging process.
Sure. So I had to completely change my diet. I had to start learning detox tools, which I wish I had learned years and years ago because it would have helped me so, so much. But yeah, I had to completely change my lifestyle, watch the buildings that I go into. I have to watch my mold exposures now, even more so, be very cautious about the foods I'm eating, and just be very mindful of everything I'm doing to keep it as safe as possible.
Okay, so the first step in the process is cleaning up your diet, being
Hmm.
aware of your environment, and detoxification, right?
Yeah.
And you
Hmm.
had to get all of those pieces in place before you began stinging.
Yeah. Hmm.
Now, were you gaining any improvement from the symptoms just by putting in those three elements of sort of cleaning up your life?
Yeah. Noticeably. I remember in I would say like the first 2 to 3 weeks of completely changing my diet, I had lost like 15 pounds of inflammation and I didn't have to sleep on ice packs anymore. So that was a very welcomed change.
Okay. Anything else? Did what were the detox protocols and how were they helpful?
It was uh detox baths, going in a sauna, different liver cleanses, just anything that would kind of help my body move out the Lyme that I was killing off, as well as the toxic buildup that I've had for so many years.
Okay. So it was your diet, it was detox. What was the third thing that you said you were doing? Oh, the get making sure that you were aware of whether or not you were going into moldy
Yeah,
building.
the
How did you how
environment
did you
piece.
how'd you know if that you were in a moldy building or not? Did you have some kind of a monitor that you were bringing with you? I mean, how would you know?
Unfortunately, I have become so sensitive to it over the years. I call myself the mold canary in a coal mine. So I generally know within 5 minutes of walking into a building if it's moldy because I will start having a reaction. So I
No,
didn't need a monitor. I am the monitor.
you are you are. So now is it something you can smell? Is it something that you can feel? I mean, what is what does how does the canary respond? Do you sing like a canary, or what is it that you're doing?
So I start getting like I smell it immediately. I start getting twitching in my face, specifically like my upper nose, like a dog. I have like sort of this like facial reaction to mold, and I also get tingling in my extremities. So it's very physical when I walk into a building, and I can kind of like feel like okay, there's mold in here. And there's always a smell too. Once you're sensitive to it, I feel like you can smell it anywhere.
Okay. So you really through this early training that you did with the Heal Hive, you were giving yourself permission to feel what you were feeling and to make sure that you did not stay somewhere, despite whatever the social costs might be, if you were in a moldy environment.
Yeah. And it was definitely really hard. I had to, stop seeing family, stop going to friends' houses. But I just noticed such a change from just not putting myself in that environment that even though it was really difficult, it became worth it because it just, I couldn't even enjoy myself when I was with them because if I'm sitting there and having a reaction, it just, it's not
Yeah,
worth me being there because I
yeah.
can't,
The mold canary could not.
yeah.
So, were there any other things that you had to do prior to starting the stinging process?
Yeah, I had to do some pretty thorough lab work to make sure that everything there was safe for me to begin stinging as far as like inflammatory numbers, and, different issues that could arise with my heart. So yeah, they wanted us to do some pretty extensive lab work before we ever started stinging, just to be safe.
Okay. So after you were given permission to stay out of moldy environments, you went through the detox protocols and you outlined all that for us. And you cleaned up your diet. You went through the extensive testing. You then started stinging, correct?
Yep.
So, what types of training did you receive about the dangers of stinging and how to protect yourself in the event that anaphylaxis, for example, was something you had to deal with on the stinging journey?
So, when I first went to the retreat, which is how I learned about the Heal Hive, we were immediately taught safety precautions. So when we sting, we always have to have an EpiPen right in front of us, as well as our phone ready to dial, just in case we were ever to have a reaction. And before we ever do start stinging, our diet has to be super low histamine for months. To make it so we have a much lower chance of having any sort of um, allergic reaction, because so much of, so many allergic reactions are kind of brought on by the foods that you're ingesting over a period of time. So we really had to clean up and have a very low histamine diet to make sure that our chances of reacting in any way were as low as they could be.
So what does a low histamine diet look like? Meaning, what kinds of foods do you have to remove from your diet so you would have a low histamine diet?
Oh, a low histamine diet, honestly, is very limited. You want foods to pretty much only be fresh. You don't want anything to be left over. You have to eliminate coffee, chocolate, any sort of ferments, anything that's aged. So really, essentially, my diet was mostly just meat and vegetables, and it was just different meats and different vegetables. And that was how I was able to stick to it, but it was very limited. I have to admit that it was not an easy diet. As someone who loves food, I think over the years, the diet piece has been the hardest thing for me, because I've gotten so used to doing all these treatments, but having to restrict my diet so much is definitely the hardest piece, but it's definitely worth it too.
Yeah, that would certainly suck. But you know what? It sucks more to be sick, right?
It definitely does.
So when you finally started stinging, what were your concerns? I mean, you did say, that because you had been on a Lyme journey, pain was something that you learned to manage, and you're no longer afraid of pain. But you have to confess you were kind of afraid of a bee stinging you. So talk to us about what anxieties you had and what it was like when you first started the stinging process.
I, more than anything, I was afraid that it wasn't going to work. I truly, honestly, I've always loved insects and bugs. The thing that I was least afraid of was being stung. I was mostly afraid that I was going to do all of this and go through all of this and then have it not work. But yeah, it's a little bit jarring at first to sting yourself with bees. But like anything else, you become used to it. And to me, it wasn't any more jarring than having a pick line or, some of these other things I had to go through.
Yeah, there's a lot of
So
stuck on the Lyme disease journey, right?
yeah. Yeah. So it just felt like I was kind of giving myself a shot. But it was slightly different.
So how do you get the bees? Where do you sting yourself? I mean, give us all that.
Sure. So I ordered the bees online from a distributor that only gives them to people who are doing BVT for various reasons. I know some people use them to even treat arthritis. So I have a little wooden box that I keep my bees in. I actually have it with me. I can show you.
All right, cool.
So my
There you
bees are
go.
here.
Oh, there they
I
are.
get them I get them mailed around once a month. And I kind of treat them as a pet. I have to give them food and water, so I give them honey and water. and I sting 3 times a week with them. In the beginning, you start with 1 sting and you slowly move up, and your goal is to get to 10 stings. And you do it on your back, and you start on your lower back and you very gradually move up to your neck. And then for some people who get that far and want to keep going, you can actually go to the top of your head, but that generally takes a few years of stinging to get there.
So Kerri, it's hard for you to do anything with your back. I mean, did you have to get help from a family member? Is your mom helping you? How do you get to your back?
So what I did is I actually got these special tweezers that were actually dentist tools, and they're super long. So I could hold the bee, look in a mirror, and sting myself. I wanted to make sure that this was something that I could do on my own, because there's not always going to be someone there that can help me. So I know of plenty of people that have had someone sting for them, but I have done it on my own since day one, and I'm very proud of that fact, because it took a lot of finessing in the beginning. But now it's actually pretty easy with these long tweezers I have. I just stand in front of a mirror and kind of look behind my back, and I do my stings. You do them on either side of your spine. Yeah, it's weirdly become routine to me, and I never thought I would say that.
So how long have you been stinging now?
So I have been stinging for around 4 years, and my stinging journey is a little bit longer than a lot of the people I know, just because of how long I've been sick. I'm treating, Lyme that's realistically been there since birth. But other people I know that have done this therapy, they have only stung for around 3 years, and they've noticed complete remission from Lyme and are symptom free, which is amazing.
So where are you today after 4 years of stinging?
So I wouldn't say that I'm 100% better, but I would say that I'm around 65 to 70% better. I knew that this journey was going to be very long, just because I'm undoing so many years of damage, and then the damage that was brought on by the other treatments I was doing. So yeah, I've noticed so many changes. My pain has majorly decreased. My energy has increased. I am able to be more functional and active, which I was never able to do. I am now much less reactive to food. Before I started stinging with bees, I had over 30 food allergies, and I was so limited in what I could eat. And Bee Venom Therapy is known to kind of treat your mast cell response. So since doing so, I am only now really reactive to wheat, because I have celiac disease. But the other food allergies I've had have kind of fallen off, which is amazing. My heart issues are gone. My arthritis is improving. All of my blood work is improving. And these are changes that I never saw with any other modality I've tried. So I have to believe that, this is all proof that it's really working and helping.
Okay. Well, listen, you've been with me for almost 2 hours, and you're very, very high functioning and very thoughtful and very articulate. And I don't think you
Thank
could
you.
have performed the way you're performing. And not that this is a theatrical performance, it's a conversation, but I don't think you could have articulated yourself as well as you have, and you could have done so thoughtfully if you weren't very far along in your healing journey. So let me challenge my new friend on two other issues. The Heal Hive was actually profiled as part of a Netflix special, and it's come up many times during the course of us interviewing folks who are doing bee venom therapy. Have you watched that special? And how would you respond to some of the concerns that some of the experts had raised about bee venom therapy and its risks in that Netflix show?
So I was actually featured in that Netflix show.
Holy cow, I didn't remember
Yeah,
that.
they showed my story in that. So
Holy cow,
I
so,
I
so we
looked
have a
much different
celebrity
though.
on.
Yeah, but that was when I would say I was at my worst. So I looked like a completely different person. I was 50 pounds heavier. Yeah. It was a perfect representation of just how sick I was, because I
Oh,
was had a hard time speaking. It really is the perfect example of, my rock bottom. But yeah,
before and after, right? So
yeah.
what was the name of the show? And yeah, oh, I'm so happy about that. So what was the name of the show? And tell us how that was a before versus your today after.
So the special is called Unwell on Netflix. And that was filmed back in 2019. So that's right around the age that I was truly at my worst. So it's great to have that visual example, because sometimes when you're in the midst of healing, you can kind of be like, oh, well, I'm not that much better, but I can go back to that Netflix documentary and look at myself and say, I'm doing a lot better than she was. So it's really nice to have that visual representation of just how far I've come.
It is, and I guess your response to all the concerns that were raised by the doctors is, look at me.
Look at me.
That's
Exactly.
really cool, Kerri. So, talk to us about where you are today, and then I want you to look back, not just at the Kerri who was profiled on the Netflix show, but the Kerri who started this Lyme disease journey, and tell her what you'd want her to know as she was going on this journey. What kinds of things would you have recommended that she do, and what kinds of things do you recommend that she not do?
I think I would tell my past self to trust my gut, trust what I was experiencing, that the next few years of your life are going to be incredibly difficult, but they're also going to show you just how strong you are, and they're going to make you into a much more empathetic and caring person who doesn't want to see anybody else suffer. I think everything I've been through has really made me a better person. And I know that's kind of cliche, but I think to really have empathy for others, you have to experience suffering for yourself, and hopelessness. Because now that I've experienced that, it only makes me want to share my story more. And I also want to tell myself that sharing your story is going to help other people, because for so long I thought that everything I was going through was kind of all for nothing. And now I have the insight to see that even with the Netflix special, I had so many people reach out to me and say, thank you for sharing this. I've been going through this for so long and nobody believed me until they saw this. So if anything, it's just, I want to tell my past self that I truly believe that all of this has been for a reason, even if it's been incredibly hard. It's made me who I'm meant to be. And I also wish that I started with the homeopathic bee venom option in the beginning. I wish I could go back and say, hey, to my 19-year-old self, start seeing yourself with bees. Screw these antibiotics. They're not going to help you. Go the natural route. I've always been so drawn to nature. I've always been drawn to bees, weirdly enough. Another weird thing that happened is right before I learned about bee venom therapy, I specifically got a honeybee tattoo because I was really drawn to honeybees. And I think that, there's all these little coincidences in life that are really happening for a reason. And that was also my little sign from the universe or God or whatever you believe in, that, this is meant to be. And this is the path that you were meant to take. And I think, sometimes the things that we're drawn to are the things that in the end are going to be the answer. And I think me always being so drawn to nature, it only makes sense that in the end, it's nature that's healing me.
Okay, so let me issue the second challenge to you, which is recency bias. One of the things that we see on this podcast, and I don't mean this to be specific to bee venom therapy, but to any therapy that people have used at the end of their journey when they've gotten to remission or close to remission. In most cases, people say, that is the therapy that brought me to remission, or that is the therapy that made me better. And what I'm always concerned about is, of course, the recency bias. It really is the last thing you've done, but generally what we see on this podcast is there's a series of improvements that people make with each therapy, and then what we do is we build on each one, and then of course, the order is significant, and it's not necessarily the last therapy, but it's the totality of therapy. So give me a reaction to whether or not you think maybe you are responding to a recency bias, and that maybe everything together got you to where you are, as opposed to you receiving the greatest benefit from this one particular therapy.
I personally think that for me, it's truly been, I don't think I'm biased. I think that I've paid so much attention over the years, and been so self-aware that I think that not only the bee venom, but, changing my lifestyle so much, those two pieces together have been the most helpful. And I'm sure that, the herbals over the years played a part too. I don't think the antibiotics did anything.
Okay.
I will stand firm on that I think the antibiotics just made me much worse.
Okay.
But I think that the homeopathic drugs and the herbals and being educated in molds and, the bee venom piece all together have really created the best outcome for me.
So talk to us about the antibiotic piece. Do you think the antibiotics didn't work for you because there was too much die-off and you became toxic, or do you think it's something else?
I think it's multiple factors. I think too, because it become chronic. It was no longer an acute infection, and I didn't treat it soon enough with antibiotics that it didn't work, because I know that, if you can treat it fast enough, like within a week of being bitten, but with antibiotics, you can properly treat Lyme disease. But since my infection had become chronic and late stage, the antibiotics became less effective, because I was just trying to treat, so many years of damage as
Okay.
opposed to a recent bite.
So let's talk about the transformational nature of this. Offline, we were talking about one of my favorite thinkers who argues that we have a lie identity, which is this identity we assume based on all of the things that people have told us about ourselves that are not true, but essentially get uploaded into our brain. We talked about the my identity, which is the response to the identity, where we're essentially trying to, create an identity that protects us against the lies that we believed. And then, of course, we have our identity, right, where we finally discover our essence and who it is that we are. Talk to us about how this was transformational, and whether or not you believe this allowed you to tease through the lie identity and my identity and find out who you are, what your purpose is, and how you were supposed to be serving, based on what God created you to do.
I think that being sick for so long really forced me to kind of learn about who I really was. And like you mentioned, I think when I was younger, I kind of took on that lie identity persona of believing things that I was being told, and that, this was all in my head, and that I'm lazy, and that, I, don't want to function, or, there's nothing really wrong. Maybe I'm mentally ill, the list could go on. But I think that being sick for so long and spending so much time on my own and kind of being forced to sit with my own thoughts, it made me realize that, I had to trust how I was feeling and trust my experiences. And it really gave me a better sense of self and made me realize that I am truly my own best friend and my own best advocate. And I think having not gone through all of this, I would never have learned that. And it also just taught me how strong I am and how much I'm able to endure, which really helped me see who I truly am. And that is a very strong, empathetic person who doesn't want anybody else to suffer or go through what I went through. And I think my purpose is to just share my story and advocate, and, make sure that other young girls experiencing illness don't have to go through years of being gaslit and, made to feel like they can't trust themselves or that what they're experiencing isn't real. If anything, I had to go through all of this so I could be there to help others and make them realize that, nobody knows your body better than you do, and you know how you're supposed to feel. So if anything, it just it made me realize that I do have a purpose, and that is in helping others, and just sharing my experience.
All right, Kerri. So in the spirit of your now understanding of who you are, we're going to ask you the final question that we ask our folks here at Take Boot Camp. And it's the new question I shared with you. We don't ask the old question anymore. We have a new question. So if you were to recommend 3 low-cost or no-cost treatment options to folks on a Lyme disease journey, what would they be?
So the first one would be fresh air. I know this can be controversial because of ticks being outside, but I think the fresh air piece is huge and it's free. And being in nature, as long as you know how to check yourself, is just so healing and so therapeutic. The second thing is breath work, learning how to calm your nervous system. That's free and you can do it anytime you want. And there's so many situations, not only in chronic illness, but in day-to-day life where I think it would be so helpful for people if they learned how to kind of calm their nervous system and how to breathe properly. And the last one is learning how to focus more on your sleep and just getting better sleep quality, and putting your sleep first, not staying up for things, that are pointless, and realizing that sleep is truly the foundation of health. It's another thing that's completely free, but I think that in our society, we're so pushed to constantly do, and that rest is kind of seen as being lazy. But I think prioritizing rest, especially when you're sick, is so important, and it's simple and free.
All right, so let's review the 3 of them. So number 1 is air. And I'm assuming you want people to go outside because of
Yeah.
the fact that the detoxification, the fresh air will have on detox. And you've emphasized very powerfully, and I think your articulation on this is very, very well done. And that is that you have to detox if you're going to heal, right? So
Yes.
we need to get into the fresh air. We need to breathe fresh air. Now, the second recommendation you had was learning breath work so that you can untrigger your amygdala and you can move from the sympathetic expression of your nervous system to the parasympathetic expression of your nervous system. Do you have any particular breathing techniques that you recommend, whether it be box breathing or something else that you'd recommend our folks consider using for this untriggering process?
I generally like box breathing. Another thing that I actually learned to do, which has been incredibly helpful, is different chanting and Buddhist chanting, especially for healing your vagus nerve. That was another thing that I learned through the Heal Hive that I found was incredibly helpful. And it feels kind of odd to do at first, for sure. But I felt such a change after chanting regularly. And even specifically, just look up the Nam-myoho Renge Kyo on YouTube. It's a pretty common Buddhist chant. And it's amazing how much that can calm your nervous system.
Okay. So now we have a fourth. You're
Yeah,
giving us a lot
sorry.
of giving us a lot of good tools. So remind me what the third tool was again. We had breath work, we had breathing fresh air, and then sleep. So what are your
Yeah.
recommendations for sleep? And of course, one of the things that we know is that our brain will not detox unless we have enough sleep, right? So talk to us about sleep and what recommendations you have to help people improve their sleeping.
So a huge piece is just trying to avoid blue light before you go to bed. Try not to sit on your phone for too long. Also manage the stressful or triggering things that you could be watching or intaking before you go to sleep. I think, again, in our society, we're kind of too focused on the news and things that are very triggering and stressful. So I think kind of creating a relaxed and calm environment for yourself before you sleep is really important, because it's been such a big piece for me because I used to struggle with insomnia and everything. Just avoiding blue light and trying to limit my triggers prior to bed has been really life-changing.
All right. So we're going to clean up our sleep hygiene. We're going to make sure that we learn how to breathe. We're going to study chanting, especially with the YouTube resource that Kerri has given us. And we're going to make sure we get fresh air. So Thank you for over delivering on our three low cost or no cost options that you recommended. This was a great interview, Kerri. I really appreciate you taking time out of your life to share this beautiful story in a very vulnerable and powerful way. And if there's anything we can ever do for you here at Tick Boot Camp, please let us know, because we're really, really blessed to have you as a member of the family.
Oh, thank you so much. It's been my pleasure.